Coffee with Caregivers production costs are covered by a partnership with United Healthcare and the National Foster Parent Association. We receive no federal or state funding and depend on our constituents and viewers to help us achieve our goals to provide support and services that meet identified needs within our mission. We would like to welcome the viewers of Coffee with Caregivers to the family. The National Foster Parent Association offers several membership opportunities for individuals, child placing agencies, and state and local affiliates. You can join today or donate at nfpaonline.org.
Good morning. Welcome to the NFPA's Coffee with Caregivers segment for this week. It's good to be with you again. I always look forward to the opportunity to talk with friends. Even though we're doing it virtually, we're certainly all learning to adjust to that, aren't we? It's a nice day here in Central Texas. No bad weather. For those of you who are still struggling with the wildfires, the hurricanes, the flooding, the mass destruction that is going on in various parts of our country, again, our hearts and minds are with you. I know that you're in many people's prayers, and just know that you're not alone. So today, we're going to do things a tad different. Usually when we talk on this program, we're talking about universal things and that are relevant to caregivers across the country. Today, we're going to be a little more specific because we're going to talk with a state. And I just want you to know that the information you're going to hear is important because this too is going to be happening in your state. It may not be happening with the planning the way it is in Texas, but it certainly will be happening in your state. And it'll be important for you to know kind of what's going on, what the federal government is requiring, what the legislation has determined as the best next steps in foster care. And this will give you some ideas about who to contact within your own state to find out, well, what are the plans like for here? What are the implementation dates? What is our role going to be in this new way of doing things? So an important message today for all of us. I got a new cup this week. I've been searching for cups because I'm starting to really run out of cups to talk to you about and how I got them and why. My friend dropped this by, and she had come to our apartment a couple of weeks ago to visit. We sold our home, our big house, and moved into a small 2-bedroom, 2-bath apartment, which is small for us. We've never lived in an apartment before, but we decided to downsize. We're getting old and we just didn't want all that work anymore. And those big house payments. So we made a big change. So lots of things didn't come with us because we didn't have a place to put it, right? And in my kitchen, I started over with a few pieces of things to kind of liven the place up. And some of the things I chose were some items from the Pioneer Woman. So any of you who follow the cooking shows probably know who she is. And so I got a Pioneer Woman cup. I'm so excited because it goes perfect. I'm going to hang it in a hook on my kitchen wall, and it blends in with some of my other things and brighten up this new environment. So good morning. Good coffee. Anyway, so I want to read something to you this morning. It was actually published yesterday, so it's hot off the press, and it was in the Children's Bureau Express. But it speaks to exactly what we're going to talk about today. Yesterday, I was able to participate almost all day in the Child Welfare Virtual Expo, which was put on by the Children's Bureau and the Capacity Building Center for States. An excellent conference yesterday. It's one day all related to exactly what we're going to talk about today. And one of the first events of the day was moderated by Jerry Milner. And Jerry is the Associate Commissioner at the Children's Bureau, and has been very influential and instrumental in the laws, Family First Act that was passed several years ago now, that has mandated a lot of things to change, and certainly gave flexibility for federal funding that's never been allowed before, and is now working with new ideas and legislation to be considered. So I think this article, although I hate to read to you, is important enough that I'm going to do that, because I don't want to misconstrue his thoughts in any way. And this article is also co-written by his special assistant, David Kelly. I've had the opportunity to meet with Commissioner Milner and with David on numerous occasions over the last 3 years. And we've had really deep discussions about the realities of foster care, the realities of being a foster family, what the system is like to work within. And they have been extremely productive conversations. We also have frequent emails that when the question comes up, they want to get the caregiver's point of view, they'll contact me, and we'll take a look at some of that stuff. Sometimes it's not something I feel like I can answer or should answer off the cuff, so we'll go to our Council of State Affiliates to get their opinions about things, if I have enough time to do that, and then get back with the commissioner. So a little bit of background about that, and then I want to read this to you. And the article is written as titled, "The Moment is Now." It says, "We must meet the moment in child welfare. There are moments in history when society and its leaders are forced to see, think, and act differently. Times when facts and conditions cannot be dismissed or denied credibly, and moments when clarity about the need for change is ubiquitous. We are in such a moment in child welfare. We have too easily accepted the shortcomings and bleak outcomes of our child welfare system for decades. The inequity present in our system is so familiar that it is expected. Most leaders can recite the headline statistics. Black, brown, or Native children and youth can be up to 2 or 3 times more likely to enter foster care. We too often fall short of meeting the most basic benchmarks of safety, well-being, and permanency for children that are separated from their families. A small city's worth of young people leave foster care every year, essentially to a life of their own, without the supports and long-term connections with caring adults that dramatically improve the odds of health, stability, and success. We know that the overwhelming majority of children in foster care are from poor families, and that 60% of all children in foster care are separated from their families due to neglect alone, not abuse. And of course, we know there are deep associations between conditions of poverty, health inequities, trauma, opportunity gaps, and neglect, especially for families and communities of color. Any honest accounting of history reveals how deep-seated such inequities are, and many of their resources and sources. Professionals from public health and medicine recognize that we too often focused on treating symptoms after they have developed. That approach too often fails to address the root causes that, let alone the risk factors of child maltreatment. Our message is simple. States and tribes must be permitted to use federal funds more flexibly to strengthen families and promote well-being, safety, and opportunity for all children and families. We should not wait for harsh life conditions and imperfect systems to degrade parents' capabilities and capacities. and then deliver the blow of removing their children. If we commit to helping families thrive before child welfare is needed and focus resources on child and family well-being, there is greater hope for families to realize their potential. We must have the moral courage to do right by families. Nevertheless, the standard response has been to improve the system at the margin, searching for services, tools, practices, or combination thereof that, if done well enough, will improve certain outcomes for some families. These efforts are helpful as far as they go, but they can easily ignore the larger issues. Fact is that we continue to spend far more by orders of magnitude in responding to familial situations that have deteriorated to such a degree that child safety is at risk, and forcing families apart than we do in proactively strengthening vulnerable families and helping them stay together, in part by providing our dedicated workforce with the tools and resources they need to prevent trauma. There remains a steadfast attachment to the existing way of operating, but it is time for a different approach. The costs of inaction are too high. We've been calling for a fundamentally re-envisioned approach to keeping children safe, families together, and promoting equity for over 3 years at the Children's Bureau. We have been calling for an approach that will invest at least as much in proactively strengthening families as it does in taking them apart. One that helps families before children are at imminent risk of separation. The Family First Prevention Services Act was a meaningful move in the right direction, but prevention must start even earlier. We are calling for an approach that demonstrates that families matter, especially poor families and families of color. The pandemic and calls for racial justice have brought all of the issues we struggle with as a field into a clear and powerful light. It cannot be unseen. Public child welfare leaders across political parties and private, faith-based, and philanthropic sectors agree that we must change our course now. The insight gained and lessons from our shared experiences in vulnerability and the inequities that have now become so pronounced call us to action. We have a shared urgency. The chorus calling for change has never been stronger or more unified. Incrementalism, sorry about that, incrementalism of the kind we typically see is insufficiently bold to address the traumas we witness. Meeting the moment requires more. It's a powerful, powerful article and a powerful statement from the Bureau. And when I saw it last night, I realized that that needed to be shared because that is the message that is now going to the lawmakers, the people who make the decisions about what happens in this country, and to all of those federal employees at the Bureau and all of those other big agencies that ultimately have a finger in the in the pie about foster care and what it's going to look like moving forward, and how that's going to play out over a period of years, because change is never easy, and we know it won't happen tomorrow or the next day or 3 years from now. It won't be done. It will take years. But we need to be prepared for that, and we need to know what our role will be in that. So given that, it is a real pleasure today to introduce to you the president of the Texas Foster Care Association. Hi, DeJuana.
Hi, Irene.
How are you?
I'm doing well this morning. How are you?
I'm good. So this is DeJuana Jernigan, who is just an incredible woman and a dear friend. We've known each other for many years, working together in Texas as really strong advocates for our children and families, and certainly for the caregiver families as well. So, our Texas families need to know about what's going on, how they, where do I fit into all this? And so we thought, what a great opportunity. Let's talk about Texas. And in that process, help each of you go back to your states to figure out how to find out some of the same information that will affect you and how you foster um, in the process of these changes. And since DeJuana is in a leadership role here with the Texas Foster Care Association and has been in leadership role with other organizations as well, and I'm sure she'll tell you some about that as she introduces herself, I thought this would be it's just a great way to introduce this across the country, this topic. So DeJuana, I'd love for you to introduce yourself, tell people what you feel is important about you, and then talk to us about your cup, and then we'll get into the meat of the program.
Perfect. Well, first of all, thank you for the invitation to have this conversation with you today. But a little bit about me is that I am a child advocate at heart. Been in working in child welfare for the past 25 years, got my start as a CPS worker. And that was an interesting entry into that field. It was as a challenge when I was in my last year in college. And someone said, if you can be a CPS worker for a year, there's not anything you can't do as a social worker. And so it was a bit of a challenge for me. And I was like, okay, well, I'm gonna try that out and see what happens. And the first 10 years of my career was with Child Protective Services. And after that, I made a move over into the private child welfare world with an organization based in Houston, Texas, called the Pelton Children's Center, and was there for the last 13 years and up until April of this year. And interestingly enough, I made a move right at the beginning of the pandemic to become the president and CEO of another child placing agency based in the Houston area called Arms Wide Adoption Services. And so that's where I serve now, in addition to my role as the president of the Texas Foster Care Association. And so my life, my career, everything has been focused on and invested in trying to make things better for children who are in the custody of the state of Texas. And so I'm elated today to have this opportunity to talk a little bit more with you about Texas's plans or potential plans for how to make the system better for the children and the families who get involved in Texas's child welfare system.
Awesome.
And so I have a cup. This is my weekend cup, my weekend coffee cup, and it's got courage on there. And it's courage takes a leap of faith. It's grounded in grace, and it's uplifted by hope. And those are the things that I feel it's to be a child advocate, you have to be courageous because you have to be willing to say things that other people.
That's an understatement.
Right?
Yeah.
And, you got to take a leap of faith that, it's going to be all right, that the right decisions are going to be made that help to make an impact for a positive impact for children and for families who have somehow become involved in the child welfare system. So
it's absolutely the truth. Absolutely the truth. We talk a lot about self-care on these episodes too. And I know you know how important that is, especially during the COVID time and starting a new job and just all the things that are the pressures that are just there every day, but then having the new experiences and new pressures. And that cup speaks to me in so many ways because it kind of speaks to if you're going to have courage and you're going to have hope and those things are going to be happening, you have to be well and strong in order to make those things happen, right?
Absolutely.
So that's another one of those cups. When I see them, I think, oh, I wish I could give everybody one. That'd be a great one to look at every single day, as a reminder of our responsibility in this life, and to pick a passion. And I may not be kids who need foster care, or families that are in trouble, as your passion, but there's something out there that's leads to a better life for people, and spreads joy and kindness in the process, that each person, I hope, finds that what that passion is and can take that and run with it, like you and I have with our passion for helping children and families. So let's kind of get started, DeJuana, on talking about this conversation. All of it started really when the Family First Prevention Services Act was passed, and we watched that legislation be built and drafted. We made lots of comments through the Texas Association as well as the National Foster Parent Association to those legislators and their staff who were actually drafting the bill. Had lots of conversations with people about it, and had a pretty good feeling about the result. Because sometimes, no matter how hard you try, they put stuff in there that you really don't know if you can live with. But we really didn't see too much of that, I think, in this last bill. But it does make sweeping changes. And one of the things that I hear the most right now is foster parents are, I don't want to say concerned, but they are. They're questioning their role, because their role is being expanded. Although, in my view, from the days we started fostering back in 1974, and we did that for 27 years, we were expected to befriend the parents of the kids who joined our family. I mean, that was an expectation, that we were there to help reunify, and help repair, if that's a fair word, that family, to help the parents become better, help them understand how to meet their child's needs, and how to meet their own needs, how to be safe. And we kind of lost that, it seems to me, like kind of in the late 80s, when privatization and outsourcing kind of started happening, and then treatment foster care became a thing. And then we started separating kids into categories and levels of care and payments at different levels. And things just kind of got screwy. And then at the same time, we had legislation that from the federal government that said, okay, everything's dual path now. Yes, it's reunification, but we're in for adoption right off the bat. So when you license or verify foster families, you're verifying them for foster or adopt, right?
Right.
That changed things, because we started getting a lot of people who ultimately really didn't want to foster, but they sure wanted to adopt. And so we started having this massive turnover in families. 50% every year for new families, 25% the next year. We haven't been able to keep many families for very long as foster parents, because they finally, get that child or children that they've been hoping to add through adoption, and then move on. And I am a champion for adoption. God knows I've adopted 4. And so, our family is what it is because of these incredible human beings that we were blessed with. And my life would not, I can't even imagine my life without my children and grandchildren and great-grandchildren now. So I'm not against adoption, believe you me. I truly believe in it. And I think everybody needs to do that. But the message that we started sending back then was more about, let's get all these kids, out of foster care, long-term foster care, and into families where they can grow better. But we stopped putting emphasis on the need for foster families who develop some tenure, and through that tenure develop lots of wisdom.
Absolutely.
To better meet the needs of the kids. So we kind of lost the families that kind of became the go-to people for the tougher kids, the kids with more trauma, who acted that trauma out more. And that then started another problem in the system about what do we do with them? Well, we put them in institutions or something. It's just a kind of a vicious cycle. And I think it's important for people to understand that cycle is not beneficial.
It's not.
It's not
It's not.
beneficial to these children.
It's not.
Regardless if their parents could make it back or not, it's not okay for the kids. We
Absolutely.
are creating more trauma for children with every single move we make with them. And that's just not okay in my book.
I agree with that. Yeah.
Yeah. So we now have direction that let's really work to find the appropriate family for the child to live with when that decision is made that they can't be safe with the current system that we have. But let's expect those foster parents to work with that family, right? Mama and daddy, grandma, auntie, whoever it is, right? The whole family, if that's what it's going to take to raise a child and then go back home.
Right.
We did that for years and had such success. And 20 years later, I still get calls from mamas saying, I think our daughter might need some help right now. It's incredible. So when we're being asked now to refocus on being more intimate, I guess you'd say, collaborative with the parents of the kids who join our family, there are some foster parents who are afraid because they've been told for years, oh, they're dangerous. You can't let them know where you live. They can't have your phone number. They can't any of that stuff. And there are certainly some parents that probably that is true if they're violent or heavy drug users and they lose control during that episode of their life. I don't know, but most parents are not like that. And so how do we refocus so that our families are not so fearful or concerned about being able to actually befriend
and
these families?
Yeah, that's
I'd love to get your take on all that.
Okay, that's a lot.
Yeah.
But everything that you have said in terms of the way that the child welfare system or the foster care system has changed has led to what I think is our system today that is unfortunately failing a lot of our children and our families. All of the statistics tell us that children, do better with their families of origin when the families are strong and when they're safe. And so that's why I'm really excited about the opportunities that the Family First Prevention Services Act will make available to states. Is because it allows opportunities to work with these families, to shore up these birth families, to take care of them, to prevent kids from having to come into foster care. Foster parents, like you said, years ago, used to see themselves as a bridge, from the child welfare system back to the child's birth family. And we've got to get back to that. And the statement that you read from Commissioner Milner, when he says the time is now, the time is overdue. We have got, this is the work that we should have been doing a long, long time ago, because we know that it's going to take a while for this culture to shift back to strengthening birth families, strengthening biological families, so that kids can stay in them and flourish and have their well-being improved. So, I'm excited about the opportunities that FFPSA can bring to states, and I'm really looking forward to how Texas is going to implement the Family First I keep saying Preservation and Prevention Services Act. I was excited to hear and to read Texas's plan, which was released on September 1st, provided some options that can be implemented to support these families through the family-based safety services and prevention services programs. And so I'm really eager to see what's going to happen in our legislative session to study some of the options that have been presented so that we can determine what the next steps will be for Texas families, because this is in my mind, one of the most significant pieces of legislation for child welfare. You know, prior to this opportunity, the only way that Title 40 funds could be accessed was after children were in foster care.
Right.
You know, and when they're in foster care, it's sometimes, that's sometimes too late. We need to catch these families very early on, even before the child becomes a candidate for foster care.
Absolutely.
And so I'm hopeful, courageous enough to be hopeful that both Texas and nationally that we're going to see policies change that support families, that support all families, including our Black and Brown families, and families who struggle with food insecurity and are unsheltered. As we know, those tend to be most of the children who enter our system. For some reason, there's this correlation with poverty and neglect. And as you indicated earlier, Irene, that most of the kids who are in foster care because of neglect and not abuse.
That's right. When I saw in his statement, in Milner's statement, the 60%, it's kind of overwhelming to me. I didn't think it would be that high anymore. And I don't know why I thought that, just, I guess, wishful thinking. Read it last night, but that means that maybe a higher percent they're there because of abuse, and that's not any good either. We've got to do better on that end as well. So I just thought that was striking. So many of the things that he had to say in that article got my attention, and I knew I needed to share it today.
Yeah. That's I think that there are opportunities for us to be able to do that, to do a better job of that. And in Texas's strategic plan on FFPSA, they did talk about some of the things that are currently happening in Texas's system that are aligned with some of the provisions of the act, which is a great step in the right direction.
Absolutely.
But we obviously have to do better. We have to do better. We have to commit to do that. Child advocates everywhere have to be passionate about being squeaky wheels and not settling for anything less than what's going to be in the best interest of children and families.
Right. I think we do have a slide that we can show. Sean, our production manager. There you go. Thank you, Sean. This is something that was put out by Tex Protects, which is also the Prevent Child Abuse Texas organization in our state. And it's a really, really good report that is, 10 pages or so. So it's way too much to share on here, but it really does line out, like you said, kind of where we are, the things we are doing already here that meet the requirements of the act, but then where we need to make those shifts and make those changes. And the main reason why I wanted to put this up is certainly not only for the people watching from Texas, that they know that this is a document they can go to. They can go to the tfca.org website and find it probably under resources. I believe that it's been emailed certainly to all of our members, so they would have this report shortly after it came out. But I want people from other states to recognize that they have advocacy organizations like Tex Protects or Prevent Child Abuse in their state. Yes. And those organizations, I'm sure, are doing the exact same thing that Tex Protects is doing, is really researching all of the angles, right, of the federal law, and then the angles of Texas, and is Texas reporting what we're doing already correctly? I mean, this is kind of a watchdog kind of thing here. We take everybody's word for it. So look for that in your state. If you don't know who that organization might be, or could be more than one, contact your state foster parent association. Hopefully they will know. Hopefully they work in partnership with those groups, right, on a regular basis as advocates within the state. But find out, who are those organizations that are really looking at this, and that are, I could guarantee you, going to be talking with your state legislators on a regular basis, and those people that make the policy afterwards within the state to get what they feel is best for your state, right? Put into your state laws. So again, that's kind of where, highlighting Texas on this particular episode, I hope will generate for our other folks in the other states that this is available. Something on this order should be available to all of them.
Absolutely.
To help answer questions that foster parents in particular have. And, I've even had some caseworkers tell me when we've sent these things out that we do this on state stuff to each state, but certainly on a national level too. I'm so glad to get this because nobody tells us anything. And then I'm like, well, join the club. Think of what it's like to be a foster parent, because they don't really even see you as that important part of a system in many places, And so talking about being in the dark and wondering what's going on, and that adding to the stress level of an already very stressful commitment to these kids is not fair, and it shouldn't happen. But when you see the staff of these agencies that are feeling someone in the dark and lost as well, it's disheartening for me. So the more information we can get out there to people, share it when you find it, right? Share it with all those networks you have in your county or in your little town, your state, to make sure that people get the information that they really need in order to feel a little more comfortable with what's coming, find their place in it, know there is a place for them, and their passion for kids, because that's not going to go away. And even in a perfect world where everything could be better, there would be no poverty, there would be no abuse. Studies have said that it takes 20 years to make a complete change in a system.
That's right.
20 years. So again, what I said in the beginning is this isn't going to happen tomorrow or in 3 years. Well, there'll be a lot of laws passed and things and lots of policies written, right? But the actual implementation of it will take a long time, because it has to then replace everything that is ingrained in our lives and how we do this work for the last 50 years.
Absolutely. That's why time is now.
But we have to start the process. We can't keep pushing it off. Yeah. So, DeJuana, is there anything else you want to focus on before we close this episode?
No, I just, I'm echo everything that you just said about increasing awareness, because knowledge is power. And the more information people have at every level in the system, the more we're able to push that change along. It's going to take a long time. I mean, we know that, but the more informed your system is, the less resistance you'll tend to have to the change. And if you've got more people who understand why and how, then I think it could accelerate that movement and help that change happen quicker. And we've got to do it. I mean, we've just got to do it. We've got too many children who are aging out of care. We've got too many families that are being destroyed and not being helped. And I can't get that out of my head. The time is now. The time is now. We've got to start doing it now. And this provides, this legislation provides an opportunity for states to be able to do that in a thoughtful and in a meaningful way, using trauma-informed practices, using evidence-based practices, practices that have been proven to work. so that you're not just throwing something against the wall and hoping it's going to stick. You know, part of the funding that comes from implementing some of the practices that are approved in the clearinghouse is based on the fact that we need to be more strategic. We need to be more intentional in child welfare about the types of services and programs that we provide to help these families. And so we can move to more of a system that focuses on family and child well-being. You know,
Exactly.
Safety, permanency, well-being. Those are, you know, the three hallmarks on which the system are built. And I think that if we focus on well-being, then we'll be headed in the right direction for redesigning and reshaping a system that takes care of all families.
I agree with you 100%. You know, when the Child and Family Services Reviews started just years ago, they really focused on safety and permanency. They didn't even have any of the measures written yet for well-being.
You're
And so
right.
states were just beating in the bushes trying to figure out how to meet all these requirements for achieving safety and permanency that they were being graded on and every 4 years. And then after a couple of rounds of that and the states failing pretty much miserably across the board every time, you know, folks started in the federal area started looking at, well, okay, we need to rethink how we're measuring these things or what we're measuring. Maybe we didn't figure it out right. But then they decided this next round would be more on well-being. And I think that when they started really working on that, looking at the design of that, what would those measures be that the states would be graded on? Is in the time frame that all this started happening to develop the Family First Act.
Yes.
I think, I mean, I know it all has a play together because we started really looking at well-being. And I always say to people, you know, when I'm talking about self-care, particularly for the foster parents and their family, is if we are to provide well-being to children who join our family because of foster care, how do we provide well-being when we aren't experiencing it ourselves? You can't give away what you don't have.
That's right.
So
That's right.
it's not selfish to take care of yourself.
It's imperative.
It is absolutely. It's imperative because again, you can't give it to those kids if you
don't have
aren't
it.
feeling it yourself. And
That's
God
right.
forbid your own kids aren't feeling it.
Yes.
Oh my, right? So this is huge. This is a new way of looking at things for the right reasons. And quite honestly, I'm kind of excited that we're here for it.
Yes.
You know, to really work to help make these things happen, but also to work to help all our constituents understand why it's happening and what is happening, because that will make it flow easier, be accepted better. And hopefully in this process, foster families will gain more respect, people in the system, be recognized as the most vital component of foster care.
Yes.
Because the healing happens in the family, doesn't happen
That's
in
right.
a courtroom or a
That's right.
therapy session or a visit. It happens within the family. So how do we facilitate all of that? And like I said, if it takes 20 years, I'll be long gone by then. But hopefully, you'll still be kicking, DeJuana, and kicking. You know what? In order to make it continue to happen. So, and I have no doubt that will be. Anyway, I think we have probably gone beyond our time. But thank you. Here's our little joke for the day. Again, related to COVID. When you can't handle one more thing. Oh my gosh, there's so much going on. I seriously can't handle one more thing. And here comes the kids. I lost my code to log into school. I spilled water on the computer. Mom? Hello? Mom? Mom? And the kids say, I think she finally lost it. I can see that playing out in practically every
Everywhere,
family in
every
this
day.
country on a daily basis. Absolutely. And it could be a mom or dad, but it could be both of them, you know, that are just catatonic already by
Not
half
one more
half
thing.
the day. So that one really tickled me when I saw it. I thought we got to share that one.
That was a good one. That was a good one.
Well, again, DeJuana, thank you so much. And
Thank you, Irene.
I love working with you and talking with you.
Same
You're
here.
just such a straight shooter, and I know it comes from your heart. And that is what I hope our audience is able to glean today too, that this is genuine care, love, commitment that is in the leader of the Texas Association at this point, and just couldn't be happier with that. So thanks.
Well, thank you. Thank you, Irene, and all that you have done and continue to do. You're truly an inspiration.
Well, thank you.
This episode is brought to you in partnership with our friends at United Healthcare. For more information about United Healthcare, please visit www.uhc.com.